This is the In Focus podcast from The Hindu.
Hello and welcome to another episode of the Hindus in Focus podcast. I'm Zubeda Hamid, your host for today. A recent analysis in the Lancet Regional Health Southeast Asia found that 1 in 5 deliveries in India are now by Caesarean section. From 2005, when the rate of C-sections was 8.5%, it has risen to 21.5% as of 2021, the analysis said. International bodies such as the World Health Organization discourage high rates of C-sections as they are associated with longer hospital stays and higher healthcare costs, burdening both patients' families and healthcare systems. So what is driving the rates up in India despite the fact that C-sections in general cost more? Is patients' preference a factor? Is this an area that could do with guidelines or regulations? We speak about these issues and more with Dr. Jaishree Gajaraj, senior obstetrician and gynaecologist based in Chennai. Hello and welcome to the Hindus in Focus podcast, Dr. Jaishree.
Hello.
Doctor, C-sections in India have risen from 8.5% in 2005 to 21.5% as of 2021. This means that 1 in 5 births involves a C-section. Could you talk to us a little bit about the reasons behind this?
No doubt the number as such has increased over the years in terms of the percentage of people undergoing a cesarean section. But we must keep in mind that lifestyle has changed. The demands of people, of women, of the families have changed. So a lot of things have also changed over these past decade or so. One of the main reasons is that women are actually planning their family much later. So when they embark on their first pregnancy, they are well into their late 20s or 30s. Second, overall lifestyle has changed. The risk factors to women have changed. Obesity has increased. The number of women who have medical problems like diabetes, hypertension in pregnancy has increased. So there is a variety of medical conditions that have increased. And over the years, the expectations of women and their families has also changed. Nobody wants to undergo pain. People want to have an elective cesarean section because they believe it is the best. They believe it's the best for themselves and the babies. So there are a number of reasons, but I'm not justifying that any of these reasons should contribute to a rising cesarean section rate.
Thank you, doctor. Could you talk to us a little bit about the risks associated to mother and child when C-section numbers are high? Why does the WHO recommend that rates of C-sections should be about 10%? And India is right now more than double this as per the figures.
Just one word about the WHO recommendation itself. Now, this recommendation was made quite some time ago and unfortunately has not been revised. So it does not really hold good in today's practice. Secondly, the risks, if you were to say, a cesarean section is an operative form of delivery as opposed to a vaginal delivery. So the risks involved in terms of anesthesia definitely exist even today, despite safe practices in technology and the regional anesthesia or the spinal which we use. In spite of that, anesthetic risks are still there. Cesarean section is a surgical procedure which involves the woman undergoing a cut, delivery of the baby, healing of the wound is involved. So all these are still high risk factors as opposed to a vaginal delivery. So yes, the complication rates are definitely higher in a cesarean section.
You said something about expectations of mothers and their families changing as well. Do you think that this is a strong factor in India for women opting for elective C-sections?
In India, we have this kind of a divide between the private sector and the public sector at large. Now, the private sector, in terms of education, in terms of financial status, etc., has changed over the decades. And therefore, their expectations, as in they do not want to undergo any pain, Social reasons, because people believe that a child, if born under a particular star, will have a very good and brilliant future. So the convictions of the family are different nowadays. Earlier they just said, yes, we will leave it whenever the child is born, we will accept what comes. But nowadays the expectations are very different, and that is why I feel there is a major contribution to this factor to the rising cesarean section rates, apart from the others that I mentioned.
It is also a fact that C sections are more expensive, correct, than a vaginal delivery. The costs of having a baby by C section are higher. But even so, the numbers are rising. Why does this seem to be the case?
I mean, certainly the cost is higher because it involves, other, the operating theater facilities, anesthesia, post-op care, nursing care. Everything is much more. The hospital stay itself is, 3 to 4 days. So there is the cost is definitely more. But there are some units, and especially one where I work in. From the beginning, we've had this policy of the same rate for cesarean section as well as for normal deliveries, because we don't want people to think cesarean sections are being done because of the financial implications. So although it costs more, I think other women choosing cesarean section seems to be influenced by many other factors. It's not the cost alone.
What is the situation when it comes to risk factors? You said that with changing lifestyles, women now have more non communicable diseases and more risk factors, etc. Does this drive how much does this drive the increase in C-section rates?
From a medical point of view or from a health caregiver point of view, if a woman is, say, 135 kilos or 140 kilos, she automatically goes into a high risk category. If she has diabetes during pregnancy, again, it's a high risk pregnancy. If she develops blood pressure either pre existing before the pregnancy or during the pregnancy, she becomes a high risk. So, when we take care of pregnant women, we actually categorize them into low and high risk. And in high risk patients, the risks involved during pregnancy, during delivery, differs greatly from the low risk category. So in these high risk women, as doctors, as obstetricians, our threshold for a cesarean section is also much lower. So we tend to make decisions little earlier because we don't want the mother to go into complications of the medical conditions that she has.
Talk to us a little bit about preventable or avoidable C-sections. Is this a problem in India? Are C-sections being done out of the healthcare provider feeling that it may go into a complication, whereas the case might be that it doesn't?
See, preventable cesarean sections. See, whenever we're talking of cesarean sections, there are two categories. We normally concentrate on the primary cesarean section, right? So when a woman has already had a cesarean section for whatever reason for her first delivery, then the reasons, for trying to go back for a vaginal delivery after cesarean, the percentage wise it is much less. So when we talk of risk factors, etc., we're talking of primary cesarean sections. And in this, if you were to look at preventable causes, yes, there are certainly preventable causes. For example, allowing enough time for pain to start, allowing enough time for labor to set in. Once labor has set in, having a higher threshold when you know the woman is at low risk for other complications. So, not to decide too early, both on the part of the obstetrician as well as the family. Giving adequate pain relief, and then we can allow this woman to labor longer. But after a certain length of time, we have families walking up to us and saying, our daughter is suffering in pain, doctor. Why don't you just deliver her? Right? So we then have to counsel them. We have to talk to them about the complications of operative delivery. And many are convinced. But despite this, some still insist that they do not want their child to go through painful labor. And then comes a very delicate situation for us because, obviously, we have to take all factors into consideration. So, yes, there are definitely preventable reasons. There is no doubt. I'm sure if we sit and review, we can easily pick up and reduce the percentage, but at least 5 to 10%.
Doctor, one of the things that has been found lately, for instance, in Karnataka, also when they're doing audits of these things, is that even in the government sector, the number of C-section deliveries are rising, and the number of preventable C-sections are rising. So it is not just a private sector phenomenon, correct?
Yes, no, I agree with you, but there the reasons are slightly different. Now, if you look at India as a whole, right, not every part of India has immediate access to a certain level of healthcare that is needed. Now, especially in northern states, the distances itself are huge. So a woman cannot go to a hospital after she develops labor pain. So she necessarily will have to travel to a place where facilities are available, maybe even a week or 10 days earlier, stay there. So the economics of that comes into play. How much longer can a family, because a woman doesn't come alone, she comes with a family. How much longer can they stay in this place where they have come to? So that's one. Two, the availability of level 2 or level 3 care for both the mother as well as for the newborn. Le- Facilities for safe anesthesia, blood bank facilities. So all these have to be available at a certain place, and then, or rather at every single place where a woman delivers. Then you can calculate and say that cesarean section rates can be prevented, cesarean section rates can be kept low. But in reality, this is not the situation. In the cities, in metros, we enjoy this privilege. But once you step out, say you just drive out 2 or 3 hours, and I'm again saying not necessarily in the southern states, but we have to take the country as a whole. Access will sometimes take even a few days. So, in such situations where a little high risk factors are recognized by the doctor, I think it's only right that they refer them to a center earlier, and where the chances for a cesarean may be a little high. So we can't just categorically say that, 1, 2, 3, and 4 are the reasons. So let us tick off one by one and we can reduce the rates. It doesn't work that way.
Doctor, you talked to us a little bit about the pain factor, about how people are not willing to undergo a lot of pain these days and would like a more comfortable birthing experience. Is that something, if it is made comfortable and better, is that something that could cause a dip in the C-section rates?
Yes, to a small extent, I think it will. It definitely will, because we ourselves find in practice that when we are able to give adequate pain relief to the mother, and I'm talking about when I say we, I work in a private sector. So when we give adequate pain relief, they are willing to wait. They are willing to wait that extra few hours. And many a time we achieve a vaginal delivery by waiting. um, there is absolutely no argument that a vaginal delivery is better than a cesarean section delivery. And I feel we should, in any way we can contribute towards that, we should try and giving them good pain relief. See, I think irrespective of whether it contributes to cesarean or not, we owe that woman a painless labor, because without pain, if she undergoes labor, she will enjoy the labor, she will bond better with that baby. Overall result will be excellent if we give pain relief. This is even out of the context of cesarean sections.
Doctor, going towards the healthcare system a little bit, is the high rate of cesarean section an extra burden even on health facilities and hospitals?
The higher section rates,
Yes.
yes, certainly, because see, the demands of, everything becomes almost 2 to 3 fold more, isn't it? Bed occupancy is longer. The per patient's expenditure of the government becomes much more. Then the recovery part of it again, see, it's whatever said, it's a surgical cut. So the woman has to recover from it. What are her social circumstances at home? With a cesarean scar, which will continue to be painful, can she really take care of the baby as well? This will affect her bonding with the baby. This can affect the breastfeeding attempts. So there are many, many things that will be influenced by a painful delivery.
Last question, doctor. Is this an area where gynecologists feel some sort of regulation is needed, or should it be upon healthcare providers and mothers to make that call?
I think everybody has to contribute to this. starting with doctors. I think we need to create awareness amongst the public, amongst our own patients who come to us. That's to begin with. Secondly, in the private sector, I feel that not necessarily private sector, women again at large, we need to educate them right from their college days about labor, about how painful or painless labor can be, what to expect during labor. So it has to start much earlier. Coming to regulation by the government itself, certainly regulations for the pregnant care of the mother during a pregnancy, care after delivery, even care during delivery are definitely required. But regulations to stipulate that one should do a cesarean section 1, 2, 3, 4, I think can never come into play, because every single labor is an individual event by itself. It's constantly evolving. We have two people who are involved in this, a mother and a baby. So it's not like we can just make decisions based on some regulations that are laid down. There can be recommendations, there can be guidelines, but you can never have mandatory regulations for a labor. I don't think it will work, and I don't think it should exist also.
You said that in any situation, a vaginal delivery is better than a C section. What do pregnant women and expecting women need to know about this? What should they know about this before they make that decision?
See, we always have something, or ideally, one should have something called a birth plan at the beginning of each pregnancy. Now, this is practiced in many Western countries, and in our countries also, it is coming in even in the government sector, where women are actually told what to expect during pregnancy, during labor. So, even when they start their pregnancy, they should be aware of what are the problems that can come up during pregnancy and during labor, not at 38 plus weeks when she comes in with pain. She's not going to be receptive at that time to any counseling that we can do. So we need to talk to them. We need to request her to attend good antenatal classes where again she will be taught about what to expect in labor, what pain relief she can get, how long can a labor last safe, within safe limits. So these are all things that have to be done much earlier. And once these are done, I think most women will be ready to accept and wait long enough to try for a vaginal delivery. And this jumping for a cesarean section will certainly go if enough time is spent explaining to them.
Thank you so much for speaking to us today, Doctor.
Thank you, Zubeda.
In Focus will be back soon with analysis of the biggest news issues. In the meantime, you can find our podcast on Spotify, Apple Podcasts, Stitcher, and other platforms. Just search for In Focus by The Hindu. We'll see you soon.